very warm welcome back, or maybe welcome for the first time. I'm not sure how high our retention rate is if we got people to come by, but it looks pretty good. Um, to this session, the second part of a two-part workshop where we focus on physical literacy and health literacy and how we can merge these concepts, bring them closer together in a shared model. My name is Jernudd, and I work with education and method development in Change the Game. We're based in northern parts of Sweden, but we do work all over Sweden and in other parts of the world as well. And we are trying to be a partner to anybody who is a movement provider, who wants help in validating, developing, and communicating their offers, the values that they're providing, and how to facilitate participation. But this session is not about me, and the reason why we are here, why we got curious about these ideas of bringing physical literacy and health literacy together, is really through a collaboration with many partners that you see on this slide, through an EU-funded project called Moving for Health, where we collectively have discussed and shared knowledge and developed an online training tool that I encourage you to look up, not now, but when you find the time, look up that Moving for Health online training tool. And the partners we have developed that tool together with are ISCA, who were the project leaders, also the European Physical Education Association, the Sport Union in Slovenia, the National Institute of Public Health in Slovenia, the University of Lisbon, and the Deporte para la Educación y la Salud in Spain. Any of our project partners here can stand up and show yourself, so we know that. Go and talk to them. They are really knowledgeable and experienced, and I'm sure we'll be happy to answer any questions related to what we're discussing here today. The structure of this session is a short introduction by me, followed by presentations and sharing of experiences from people who are driving and contributing to implementation programs around the world using physical literacy and health literacy. I'll introduce them in a minute. And then we have a section that is the main course, part 3 there, where we invite you to continue co-creating the models that we started drafting in the first half of this session. Around your tables, you will get some questions to work on and develop the model together with us. So probably with this explorative approach, you will leave here with more questions than answers, but that's the point. This is really complex and a large problem that we're trying to address related to movement and health in our populations. Before I go any further, we wanted to give an opportunity for you, if you were here in the first session, we encourage you to think about some insight that struck with you, some aha moment, and maybe some question that you brought with you to the second part. And if you were not here for the first second, you're here for some reason that sparked your curiosity and interest, so you can share that. And talk about that with your table friend sitting next to you. And listen to them, and we have a short exchange of reflections before moving into the presentations. So do that now, please. Okay, I will ask you now to stop your discussions around the table and open up for hello, hello. Don't talk anymore about how interesting the first session was. I can't stop you. Oh, nice. Yeah. Oh, thank you. That was good. The ting, ting, ting. Can you help me with that if I need it? Yeah. Nice. Thanks, thanks. I don't have a bell of my own. I wanted to give the opportunity if anybody wanted to share what they said, or if they heard something interesting in their small talk that they would like to share to everybody. We have a minute to listen in to some sample from somewhere in the room, if we have one. Yeah, Nigel, please go ahead. There's a mic there.
I'll just share what the sorry, what's your name again? Nikolai said here, and he loved the diagram that Charlie put up from Sport England with the different shapes, because he works in a small community, and he thinks it would be nice to talk to that community and talk them through the shapes so they can understand physical literacy better. So it'd be a nice, simple way to get the community engaging with the concept.
Right. Oh, well, thank you very much. Thank you for sharing that. Any other? One more. Oh, do we have time for one more? Yeah, please. Have a mic coming.
Thanks. You can hear me.
Yes,
yeah,
you're
yeah,
good.
yeah. It was actually the closure about the Italian family that brought my aha attention up to that. Often we don't know what is the trigger to somebody else to make a healthy decision or
Right.
another decision. So yeah, the curiosity
Yeah.
and the exploring that what would actually make a change.
Oh, nice. Yeah. Thank you very much. Yeah, we never know what's gonna stick with people. We're shooting pretty wide and hoping that there is a sense of a common thread, but we're all gonna have different experiences, obviously, from learning about this. Thank you very much. Some of my own thoughts are, well, now we know that people make a lot of health and movement related decisions every day, and it's really complex and large problem, and we are going now to move on from what and why physical literacy are and why we need it, and more towards how we can use it. How can these perspectives inform our practice? And that's the aim and the framing of this second part. So what better way to do that than with some presentations? We're going to have a fireside chat where I invite 5 experts from around the world up on stage to share their knowledge and experience from using with physical literacy and health literacy in practice. So I will be over here, and I will read out all their names, roles, and organizations that they're affiliated with, and then they will all come up at the same time when we give them a warm round of applause. So we have with us today, I'm happy to say, Drew Mitchell, who is the Chief Executive Officer at Sport for Life in Canada. We have Charlie Crane, Head of Children and Young People Policy, Sport England. Amit Malik, International Advisor and Trustee at the International Physical Literacy Association. Kristin Sørensen, Founding Director of the Global Health Literacy Academy, and Dean Kriellaars, who is a neuroscientist at the Research Center for Human Potential in Montreal. A really good group of people. Let's give them a warm round of applause as we welcome them up on stage. Yeah. Come up here and have a seat, please. I will have a seat here. Okay, thank you. Nice. Yeah, I got myself I'm moving up in the world. Yeah. That's great. Oh, Dean already has a mic. Everybody good? Good to have you up on stage again, and welcome for the first time to Drew. If I recall correctly, you are first out, Drew, to share a little bit about your work. It says there that it's a secret, but now you're gonna tell everybody. So I don't. If you would like to use this with the green button, you can move the presentation forward. But the floor is yours.
Thank you very much, Grim. And first of all, I want to say thank you to everybody here from around the world for being open to speaking English. Being from North America, we're a little limited. We do speak French in our country, and a lot of Americans speak Spanish. But the bottom line is we're very English-centric. And in Europe, I find you speak many languages. And I absolutely appreciate your openness to speak English and so that I can understand what's going on. So thank you for that. So physical literacy is something we've been doing at our organization since 2005. We've been in the game for a long time. And we're very fortunate to have made lots of great partnerships and associations down through the time. Dean and I have done a lot of stuff together. Some things were even good. it's been very interesting because when you try to operationalize something that's a little bit more complicated, it's not always easy to do. So, trying to work at the national level or work at the provincial level or even the local level, you run into a bunch of barriers. So in our country, we created this concept called physical literacy for communities. So the idea is how do we get people out of the silos, give them a common goal and common focus. So collective impact is something that's been out in the world for a while. It has a bit of a collective impact kind of approach to it. But the whole idea here is when you get health, education, recreation, sport, indigenous, newcomers, disability, all those different groups together, city planning, and you have them come together and build knowledge together, build awareness together, build some training capacity together, and then build some sustainable components, you have the potential for that community to change its state, which is really what we want to help people. To me, it's about opportunity. When I was young, I had lots of opportunity to roam my neighborhood, to be with my friends, no adults telling me what to do. That circumstance doesn't live so much today. It really doesn't. And so whether it's the work that we do in Canada or the work that Moving for Health does in Sweden or others in different jurisdictions, it's all about getting people to understand more, to learn more, and be open to trust each other as they go forward. So it's about allowing everybody to have a seat at the table. And really, this idea that you can do it by yourself, no, you can't. It's about collaboration, and even collaboration moving to partnership, true partnership. It's more voices making and more perspectives. It helps you make things happen in a different way. And to me, that's one of the great options for us around taking the concept of just physical literacy and evolving it into health literacy, because it really does expand the table. It allows you to go deeper into a community. It allows you to look at different funding and different opportunities. And to be honest with you, my greatest challenge is how do we crack the healthcare nut? Because that's where all the money lives. And we need to move away from just fixing people and treating people to actually helping people be preventative, have a higher quality of life for their whole life. So sometimes it takes, that's my bad, sorry, Charlie. It's important that we all understand that it takes sometimes bold decisions to make change. And I ask you all to be open to being bold. Thank you.
Thank you. Thank you, Drew. I think we already got a sneak peek there that Charlie is next, so you can go right ahead, and we're gonna have the Q&A at the end. So we'll hear from everybody, and if you can think about questions meanwhile they're sharing, write them down and save them for in a little while. Go right.
Brilliant, fantastic. Thank you, Drew. Thank you, Grim. So I said in this morning's session that we released our national consensus statement for physical literacy back in 2023. And I'm going to spend a few minutes talking about how we're implementing that consensus statement at a policy and practitioner level. Once we published the statement, it became quite clear quite quickly that partners and organisations loved the consensus statement, really got behind it, but didn't know what to do with it. They didn't know where to start. And I think that was something we really wanted to tackle head on. So within a year, we launched something called the Positive Experiences Collective, which aims to bring together a diverse mix of partners to better understand what physical literacy is, why it matters in tackling inactivity and inequalities, and how they can begin to apply the consensus statement that I talked through earlier into everyday policy and practice. And I've put these snowballs on the screen because to us, we see the Positive Experiences Collective as building snowballs for change, that each and every one of the partners involved from our diverse range of sectors is helping drive this change, drive this cultural change that physical literacy matters, movement matters. And there's 4 parts to the collective, which I'll talk through now. First is the Patchwork Programme, and we affectionately call this the heartbeat of the Positive Experiences Collective. And over the course of 2 years, we will be working intensely with 75 different organisations from across our country. Some of those organisations are in health, education, planning, community sport, you name it, they're involved, which is great. And they're all coming together to test, to learn, and really start to bring the consensus statement to life in their work, for physical literacy to be part of their narrative and the North Star for their work. We're then generating the stories for change, because we found with physical literacy, at a policy and practitioner level, we need to show the so what. And actually, through the Patchwork programme, we're generating 75 stories of the so what. And we're sharing the learning and some of the trickier challenges through free and online listening circles that we're holding 4 times a year, and an annual conference. And I'd invite anyone in the room today to be part of those listening circles and our annual conference, because we want to share this knowledge beyond England. And we know we've had some colleagues, so Tom and Grim have been involved previously, which has been great. So please do get involved in that. And I think one of the key learnings, drawing on what Drew said, is we've heard from the partners that providing the protected space and time to really deeply think about physical literacy in their own unique contexts, but sharing ideas, thoughts, approaches, has been hugely valuable for physical literacy. But in my case, just children and young people matter, co-design matters, their voice matters, all of these things matter. And actually creating this collective is helping bring like-minded people together. And I think for us, it's the mix of different organisations representing different sectors coming together with this united vision around physical literacy. And so from our perspective, one of the key outputs of the first year of the Positive Experiences Collective, we're just heading into year 2, is a set of action-orientated principles. So we've got the consensus statement. That's like the deep thinking, the credibility, the robustness of academia, research. But we've actually, and Nigel and Jade in the room here today, have contributed to working with partners to create a set of action-orientated principles on how to bring our consensus statement to life. And we envisage this Thrive set of principles, Thriving for Positive Experiences, to be on an equal footing with our consensus statement as the years go by. And I think really, if I was a teacher, if I was a coacher, a policymaker, these are a set of easy to follow principles where I can deeply think about my policies and my practice and start to bring the consensus statement to life in my everyday work. So for us, we've been on quite a journey. We are fully committed at Sport England in helping partners navigate and apply our consensus statement. But we wouldn't be anywhere near where we are without all the learning of other countries. We've been able to jump on the back of so many fantastic work internationally, and I just wanted to recognise and thank you all for that. Within England itself, we've had some brilliant partners. We've got over 300 organisations now involved in our collective who are championing this at a local through to national level. And without their energy, their expertise and their time, we wouldn't be getting this to take root into our everyday work. So hopefully that's been helpful. And please do visit positiveexperiences.org to register and find out more about the work and get involved. Thank you.
Yeah, thank you, Charlotte. I think I just got an invite to the next listening circle yesterday, actually. So yeah.
It's the 6th of November, 10 till 12, and we'll be sharing more of the learnings from the 75 teams. I'm not on a PR push. It's just a free thing. It'd be great to see some of you there. Thanks, Grim.
Yeah, thanks. Okay, Amit, I think it's you now. Of course. Yes.
There's the bell.
No worries.
So from India, one I want to share about the effort of the advocacy. Here you can see Nigel Liz coming to India for the first time in state of Andhra Pradesh in 2016. And that time we could influence Chief Minister of the state to look at physical literacy as a key priority. And I remember one line which he said, I was always focused on result through medals, but now I learned something new. And he said that we need to build more playgrounds, but not build new playgrounds, break hospital and make them into playgrounds. There was a word he used. When everyone will play in this state, we don't need hospitals. And then he said, also we need to visualize more sports shops instead of medical shops. How many in your vicinity? But that is very powerful for us to resonate at a leader's vision. And Gopishand, our national coach, he has been very vocal. Second picture is with India's sports minister. Uh, Third is he met Prime Minister personally to talk about it, that after producing many Olympic medalists, I'm feeling that I'm an unsuccessful person. Because when we choose talent, we reject participation most of the time. And that was very powerful coming from our most successful coach ever to the Prime Minister. And he said, what we need to do? He said, we need to look at things differently. And it is a vision for every Indian being active and healthy for life. There's a vision we need to set for. A lot of state governments we have worked with. Now, some outcome. Our new national sports policy has physical literacy as one of the 5 objectives this year, last 1 decade effort. The Supreme Court of our country has asked all the government to consider physical literacy as a fundamental right of each citizen by changing the constitution. That is also ongoing at a legal level. And multiple sports and education policy have been able to integrate physical literacy. So advocacy part, but he mentioned to me that do let everyone know that it required him at least 100 meetings with all these policy makers to reach where we are. So there's a huge quantum of effort and continuously influencing sometime policy makers, sometime media to absorb it. Second, as Charlie said, we were clear that we will not own physical literacy concept. We will evangelize physical literacy concept. We will let it be the journey of each of our partner. And therefore, we have worked with government, higher education, school education, sports department, corporate. Some of these names are there. But just to share the scale, India has around 80,000 full-time physical education teacher. We have reached almost 50,000 teachers by training them in person or online. More than 1,000 sports or education leaders who are district sports education officer or the sports of, education officer. In higher education, almost 10,000 students who are going to be future teachers in next 1 or 2 years. They have been oriented on physical literacy. And I feel that student was more powerful than the teachers, because a lot of teachers are close to their retirement. They are not very keen to change. But the liberal language of physical literacy are very well received by young students. A lot of corporate clients as well. But our success has been more through building partnership and doing a lot of work, which is, I would define that, I was summarizing, I was thinking how to say it in a poem. I was thinking that when we didn't have funds, we still moved. When we didn't have the support, we still moved. When we didn't have any support, belief from the government, we still moved. And rather than moved, we become resolved. Rather than moved, I think resolved was a feeling for us. And Gopichand, the national coach, I asked him, was a target for us this year target? He said, until everyone plays. This has to be target of everyone. Why you're stopping around that? Um, and some part around that, how we have been able to create more. I would not call it awareness. Awareness, we failed. We could not create awareness. We succeeded when we asked people to experience, reflect. A school principal who is not convinced, let's go for a walk, come back. What did you feel? What did you engage in? So our method work, let people experience and reflect. Don't tell them. And when we checked with everyone, knowledge was not the issue. I can guarantee everybody knows few activities and their benefits. But it's more about the motivation part, confidence part. Then we connect a lot on the culture and practices. So our focus has been more on the ground. I'm on the ground almost 20 days in a month, traveling all over different districts, states to make it work with different stakeholders. And third, as I said, that we have been able to reflect on the lived experience of each individuals. And I was having a conversation that physical literacy, we just keep very simple. It's lifelong journey. Just to give you an example of, for some school and adults especially, in school, we have switched to only qualitative self-reported progression metrics. We don't use the word assessment. Each one has emotional journey of progression, so progression has to be the key consideration. Same way for the adults as well. It's more about the same motivation, confidence part. What movement forms I more associate with, whether aesthetic, competitive, social, interactive. What movement I look forward to. That has been our model to look at holistic aspect of it. And for the assessment part, just want to give a small example. When Nigel started working with one of the school in India, we came up that student will self-evaluate. It is a basketball class. We just give them a core task. The student will self-evaluate. They're at beginner level, intermediate level. And when they start working on their learning target themselves, it becomes a celebration for us. So this is the way I would summarize. Our journey has been very resolved journey, intense journey to make it happen at any cost.
Thank you. Yeah, thank you very much. I think somebody asked him later about that new way of comparing students to themselves only, and somebody asked that later. Well, moving on to Christine, please hand over the clicker, and yeah, let's dive into your work on health literacy.
So thank you very much for being part of this panel and listening to all the great examples. I wanted to start with a question to you in the audience. How many of you have been shopping in IKEA? Grim is from Sweden, so I was thinking, have you been to IKEA? Okay. Have you been assembling the furniture that you buy? Okay. How many of you are do-it-yourself? You know, I can figure this out and I'll build it. Right. How many will read the manual first? Okay, a few of us. So these are two different mindsets. One is very entrepreneurial, let's do it and fix it, and others will like dive into it. And some of you heard my my story in the last session. I'm probably the last one trying to read the fucking manual first and go into it. So that's a bit my approach to health literacy as well, diving into definitions and models and trying to get my head around it, knowing, of course, the creature, we can't see it. There is no furniture in front of us. We're just trying to build the plane as we fly, but there's no plane. We're trying, it's all very, fluffy. So that's completely okay. But at least I try to make a little bit of sense of it. And I've been working with the World Health Organization in Europe, in Geneva and elsewhere, looking into healthcare systems and how do we add health literacy to it, knowing that the historical development focused very much on the individual's health literacy. Now then moving on to how can organizations and institutions implement health literacy. And my role has been very much to push it to a systemic level, saying we can't do this on our own. And this first diagram is one of the manuals I'm trying to develop, where we can see that there are different ways we can implement health literacy. So this is one of the projects I worked on with the World Health Organization as a concrete example, but a very global level, very strategic level. Well, health literacy happens also in the boardroom. The leadership needs to be there. The boardroom is where you take the decisions about the vision, the mission, like you were talking about, Charlie, but how do we bring it to life? That's by doing interventions, putting in human and financial resources, but also making sure that we use technology and innovation to bring it to life. Work with different partners, not least trying to educate our workforce about physical literacy or health literacy in this case. And working on it at an organizational level to develop health literacy strategies. This could be, for example, also in a country. I know we have colleagues from Slovenia here, and congratulations, you just had your national action plan on health literacy in Slovenia. So I'm very, again, talking about organizations at different levels here, could be a government. And trying to have also the data. But data is not alone. We have to add it to the experience, to the personal stories, which is the last one, people-centered services and environments based on user engagement. Sometimes as a researcher, we try to dive into all the statistics, but the numbers are not enough. It really is the experience. It's much more complex than just a graph. even though it can be really helpful. So this is one example I wanted to share with you. You might come across this manual, then you know it was an attempt to try to build the furniture. What I try to do in my own work when I work as a consultant is try to make health literacy flourish. And I truly believe the future is health literate because we shape it. So I'm looking at elements where we can shape, where we can play a role. And it starts with, for example, information. Somebody wrote a book. Sarah, you were telling me you've written a book. You know, there's a concrete piece of information that can be shared with your students. Others write blogs or websites. But this is where we can influence. But the language differs whether we talk to politicians or to kids or to other researchers in scientific publication. And it's an art in itself to communicate. But that's one leaf. The other one is on products. How can we make easy to use products? And you use it a lot probably in the sports world. Lastly, also the health literate services. Here I talk about the journeys, the services that we provide, for example, in healthcare, but it could also be in other settings. Then we have our organizational values, strategies, vision, and mission. And lastly, taking into account the health literate people. And some of the information products, that's very concrete. Now we're talking IKEA. But for the others, that is where it's about relations, interactions, and so forth. Let me give you an example. This is in schools. So the way we teach the health curricula or physical literacy curricula, that's in the information part. What kind of products do you use? It's easy to buy a ball to play around, but we also heard that hockey in Canada is apparently $20,000. So, and I thought it was just a stick or whatever, but no, okay. So it's not only easy to use products, but also easy accessible products here. Then we have the interaction. It does matter what your teacher or your trainer or your coach. Nobody likes to be told what to do, but you need someone who motivates us. Some are better than others. Then we have the whole school setting. How health literate or physical literate is that? The school setting, the communities we live in, how accessible are the things. These are all based on the values and priorities that is being done at local level. And then the kids. Is it actually tailored to the people that we try to work with? The same with elderly. Everybody is very different. How do we make sure that elderly learn about health and healthy living? What kind of products can they use that is easy to use to keep them healthy in everyday life? Can we do some teams for them locally where they can come and be with others so we strengthen social relations? Somebody took a decision to actually organize that. Is it the municipality? Is it the sports clubs? Here we're talking organizational health literacy. And then we need to really tailor it to specific ways of training. And I started sea kayaking as a very, just a few years ago. I put myself in a very uncomfortable situation trying to get into the kayak. And my teacher, she was this very small little woman, you just jump into the kayak and you stand up like this. And then and I was like, my other one, she was bigger, larger than me. And we looked at this kayak and it's like, oh. And then she was in and out. And the rest of us, we were like, okay, we got into it, but how to get out of it? And, my other colleague, she was a bit wider here, so swapping out of the kayak, and then I asked the question afterwards. I mean, we can't change right now. Do you have bigger kayaks? And so she had never thought about it. Her kayak was for her, very and so the same also with life vests. Apparently, they had one size life vest, but this other lady, she was very big, and we couldn't kind of come up again in the kayak. So just an example of there's no one size fits all. And I think with this mindset, hopefully we can remember that also when we teach and get everybody on board. Thank you.
Yeah, nice. Thank you very much. Yeah. It just struck me from looking at your health literacy by design in schools, and only one of the 5 branches there said school. So that really reinforces the importance of thinking of a wider context of.
And just also
Help
to
them.
remind, if one leaf is missing, we are not making
Yeah,
you know,
yeah.
if we don't provide the information right, the other things will fail. If we don't have the priorities right at organizational
Yeah,
level,
I
we
thought
will
that was
fail.
really
Yeah,
powerful.
so that's the idea of the blueprint.
Yeah, thank you, Kristen. And okay, last of all, let's hear from Dean Kriellaars, and then we're opening up for questions.
Sure. Amazing, eh? And these are just little snippets. I mean, each one of these people I know well, and I know your research really well, and I use your diagram a lot. And what's important is that I'm not just an academic, I'm a person who does the practical implementation. So that's what I'm going to talk to you about today, but I'm going to tell you about images that have helped make changes in these different scenarios. So this is the first image, which will really resonate with Charlie. And so Sport England's, I'll call it evolutionary consensus statement is wonderful. I really, really like it a lot. And I completely concur with the notion of positive experiences through movement and then how powerful that is. So I do research, of course, but this diagram is very powerful because what we've been able to show in multiple studies and implementations in real life, other than our academic implementations, is that you can activate the physical literacy engine, if you want to call it that, where you can develop competence, then confidence, increase valuation of movement, and also motivation to move, which then activates participation in society through movement. You can see that cycle. Now, that is very well evidenced actually in science, but it's a nice cartoon picture, isn't it? But you'll notice that there's 4 domains there. One is a creative domain. You can become creative through movement. You can become better socially through movement. You can get better psychologically through movement, not just physical things like better bones, better heart. I'm more interested in better brains through movement. That's all I'm interested in, personal interest. But what's interesting here is that we've shown that you can activate this cycle, which what Charlie would call a positive experience. And then the emotions that you get from that are things like joy, enjoyment, pride, I believe I can do something, and connection. Those are the big 3 emotional reactions people get when they have a positive movement experience. But we've also shown you can deactivate this engine and go the opposite way through, and that creates emotions that are anger, shame, and boredom. Now, we've done some really interesting studies to show it's not about eliminating shame. It's not about eliminating boredom and frustration or eliminating anger. It's about making sure they also have the positive components. You cannot eliminate shame. You can minimize it, but you cannot eliminate it. But many people come into movement settings with shame. You do not treat them the same as people who don't have shame. And that has been super valuable for our coaches, for our phys ed teachers, for our parents to learn that. It's not anti-shaming, it's about covering shame with pride and enjoyment. But how does that happen? So we use this model, which is what we're going to talk about today, where we say and we did this morning, we said there's a bunch of people that influence my life. And Sarah and I work on this diagram a lot. And those people are agents. And they're people who can influence you for your health decisions, your physical activity decisions. And they are people who equip you with things you need to know to do something right. But as Kristen said, as everybody said here today, if your community doesn't have the resources where you can go, the people, places, and programs that are necessary, you can't blame the individual. We do too much to the individual saying, take responsibility. But if there's no resources, you're in trouble. So we use this diagram for all our interventions. That's why I'm showing it to you, to say, how do we equip people? If they need to seek an answer, where do they go? And then how do we resource the community with the right resources, which is Kristen's flower diagrams. But then, only then, when you have the resources, the proper equipping, can you then actually ask people to execute good health decisions as opposed to blaming them. So we've done this for all the literacies that you see on top there, and it's worked very well, this process thinking, and it beautifully marries to Kristen's work. It provides some detail to that lovely triangle diagram, etc. So I'm going to finish with this. We've had so many success stories in Canada and other countries, and that's a list of them. One of the things that I'm really proud about is that where I live, we've created an entire kindergarten to grade 12 curriculum for physical and health education based entirely, the world's only, health literacy and physical literacy. And it is a beautiful thing. But that's only one part of the puzzle. Health and physical education are critical parts, but you can see here I've listed some other ones, and I'm here to chat about these other success stories. I can't read it from here, from my glasses, so I have to turn here. But and what's really important, and everybody said this, and Amit has said this quite a number of times, you can't take what we did where I live in Winnipeg, Manitoba, Canada, and apply it elsewhere. You have to take the principles, the Thrive principles, and see how do you do it in your culture. And that is a very important thing. It's not a cookie cutter approach. You have to be able to adapt the approach. So this is a little slide that just are key messages that I want you can read it. You don't have me to say it because we're probably short on time. But I do want to say we've had many success stories in sport, in physical education, in health care, in using this approach. And we use a blended health literacy, physical literacy approach. And we find it extremely valuable to now, in the physical literacy world, really embrace the notion of health literacy, because you can't really work outside of that. It doesn't really work, and we need to have that cooperation. So I'll stop there because I'm going to be chatting with you a little bit more.
Yeah.
But I'm very happy to share all of this with you. So if you're interested in getting it, I actually have a QR code, and you can just go click and download everything. We give away everything for free. So we've got that later on if you really want to have the success stories.
Yes, thank you, Dean. I really think people will appreciate that open source and sharing. Sharing of resources that you might not be able to straight copy paste, but you can learn from them and adapt it to your context and culture. Very nice. I thought for the Q&A now that I would ask a first question to give people a moment to think about if they want to ask a question also. You can do it live by raising your hand and getting the mic, or through the app where Carol is keeping an eye out for questions popping up. Yeah, so, well, first of all, because, well, Drew, you went first, so you've been waiting now for a while, so, but I'm going to ask you about something that everybody mentioned. I think it's a shared element for any attempts to develop physical literacy and health literacy communities, which is, well, you said that when you bring them all together, but that's like sometimes easier said than done. So I wanted to ask you, for this multi-sector collaboration that is absolutely essential for getting all the relevant stakeholders and people to support individuals in this system together, how do you get the relevant stakeholders to the table?
Bribed. It's been very interesting. If you give people a fairly simplistic goal to start with, usually we have seen very good success that people are at least curious. And if they're curious, then they're inquisitive. And if they're inquisitive, they'll tend to gravitate towards something. Probably the biggest challenge we see in this situation is a lot of funders will fund programs. And you probably see this in your spaces, but they don't fund leadership. Mm-hmm. So a project needs good leadership. You need to have good leaders to go out there and help build relationships, to help foster trust amongst the group, because what happens with a group of people who haven't necessarily know each other, you're helping them to build relationships, but and trust, but you're also helping them to try and change behavior, which this is all a giant behavior change experiment. That's what this is. And it's very hard to measure that. And it's very hard to see how change happens. But I think if we can start fostering better relationships between people, we can start to deal with challenges in a different way. And that's what we've been seeing at the local level, that we find most of the solutions live in the community already, but they don't talk to each other. and they don't work together. So if we can help through leadership foster those connections and help them to realize that they can actually pull on the rope together and they get a greater outcome, it tends to work. So it's not necessarily about a ton of resources. It's about utilizing what's in the community together better at the end of the day.
Right. Thank you. Anybody else would like to say something about how you are thinking about the multi-sector collaboration that is critical to doing this work? Christine?
Thank you. So coming from the health promotion world, I've always seen people working in the sport and culture as health ambassadors, but I'm not sure that you or the people working in this sector saw themselves as health and
Right.
well-being ambassadors. So the big challenge is also to own that part of the profile. And people say, yeah, but I'm not a fitness coach. I'm not, as a teacher, trying to convince. I'm not the health specialist. But the thing is, we don't need to be health specialists. We just need to be good friends. I worked with a project in a small place in Denmark called Vejen Idrætscenter. But Vejen is in the middle of nowhere, but they still get 1 million visitors a year. And it's like a zoo getting a panda. When a zoo gets a panda, they have 800,000 extra participants. So I was interested, what do they do there? How does that panda look like? That I say he, because it turned out one of the keys were that there is a leader who is very entrepreneurial, and he relates with locals, and he we're all friends in one family. People will put in the chairs when they've used them. They will clean up. They will make sure that there's coffee for everyone. It's not if a fitness machine breaks down, that's okay. That can be fixed. But if the coffee machine breaks down, then hell is loose. And that is the feeling we want to create. So he said, our members are also health and well-being ambassadors. He was a health and well-being ambassador. But before we started talking about it, he didn't realize that. But now they do. So it's part of their profiling. I do hope that you will take this with you as well and be proud of it.
Yeah, nice. Yeah, thank you very much. I'm curious now if maybe we have somebody in the room who would also like to ask these people a question. Yeah, go right ahead, Andrea, please. You can get the mic there. What? No, that's fine. That's the point. You get the mic there.
Yeah, actually, I have two questions, one for Christine and one for Malik. Christine, in your opinion, where do you see physical literacy according to the health literacy? Is it a standalone literacy in your opinion, or is it a subgroup of a health literacy? What's your opinion?
So yes. I lean very much on the definition on the World Health Organization saying that health is physical, social, and mental well-being. So for me, they're so closely interlinked. It's not a standalone. It's one piece of the pie, so to speak.
Thank you. And Malik, you mentioned the national sports policy. And one of the objectives being related to the physical literacy. So congrats, because this year in Slovenia, we also established a new one for the next 10 years, the national sports policy. But apart from me and two other experts, nobody wanted to hear anything about physical literacy being a part in a national sports program, which is a sad story. But luckily we have a health literacy policy, so we'll include physical literacy there. And we are also preparing a national healthy nutrition and physical activity for health policy, which is going to be also included. The food and the physical literacy, both of them in them. So how did you manage that? And is that objective measurable?
So how do you manage that? We did a lot of work and conversation around it. So every week we do something. Okay, this we are doing in corporate, in schools, but we are on the ground, and that they had to take notice of. So one was a lot of quantum of work. Athletes, especially Gopishan, and we have India's first Olympic gold medalist. He also got convinced about physical literacy. So they had more say in the policies rooms, the leading athletes and coaches. They start talking about it. So it's a collective consciousness which has built. And in one of the discussion, our India's athletics coach, national coach, he doesn't know me and is happy how the word is spreading. He said, earlier I thought physical literacy is about doing some fundamental movement skill and athletic skills, but I learned it is about lifelong engagement in physical activity. And I was so because I never met him, I don't know him. So maybe some conversation happens in all those doors. In terms of next step, struggle is to get the funding for it. Everybody wants it to be a priority, but funding is very big challenge. One of the state when we simply looked at how much is the budget. So they say 10,000. I say, what is the priority of physical activity in the whole subject? Say 1/10. Give 1/10 budget to sports or physical activity because that was only 1%. 1% budget was given to within education to sports and physical activity. Teachers were less, equipment were less. So we understand the budget will mainly come from education and health sector, even for physical literacy. It may not come from sports. So we are trying our best now that it should be provision budget now every year. That is our next battle.
Yeah. Okay. Yeah. Thank you.
Exactly. Yeah. We have to measure it.
Nice. Yeah. Thank you very much. I I want to get a question from the chat if we have one in a minute. But in the meanwhile, I will ask to you, Charlie, because well, Christine said that it's an art in itself to communicate to different audiences. Like, what's the starting point for whoever is in front of me? What's important to them, and how, what words will be suitable? And something that you're doing very well, I think, with the new consensus statement and the implementation program, a positive experience collective, is you're not only relying on the words physical literacy and health literacy and assuming everybody has a shared understanding, because that can be quite intimidating to somebody who's not familiar with these concepts. But you're calling it positive experiences and explaining more the meaning and what you want to achieve. So why was that important, or what's the effects of that you've seen?
Really good question. So I go back to sort of 18 months ago, and actually it was a realization. I think, being very honest, physical literacy as a term is a bit like Marmite in England. Some people love it, some people go, oh, okay, and run for the hills. And actually, we think about this in two ways in England at sort of a policy level, which is a positive movement experience is something we can control in the here and now. Every time someone goes to their local community club or goes out for the walk in their local environment, is that a positive experience? That's a short-term change we can influence through upskilling our teachers, our coaches, creating the right environments through city planning, with a line of sight to physical literacy being that lifelong engagement. So we see one leading to the other and the other, so it's a two-way process. So I think for us within education, Jade and Nigel here again, we talk about physical literacy. It's a term they're familiar with. It's a term we feel they get. In community sport, a little bit less so. With some of our governing bodies, they've shied away from physical literacy as a thing. But actually, they really want their coaching and club networks to deliver brilliant experiences so those people keep coming back again and again and again. So I think for us, we wanted to call it the Positive Experiences Collective because it sort of captures, we feel, at where we were in our journey in England, a much broader representation of partners and representation from sectors, and then we drip feed physical literacy in. So it's almost like a bigger hook, and then we upskill them in the knowledge and understanding around physical literacy and how to bring it to life in their practice.
Oh, thank you. Anybody else who would like to say something about that? How you're navigating, using the word or explaining what you mean, and when you do one or the other? Yes, Kristen.
Yeah,
Please.
not just a comment to so starting with the end in mind is what you're doing, a positive experience, and then finding the tools necessary to achieve that. And what I loved here is that you didn't stop just because you didn't know what physical literacy was, because just because you don't know that, it doesn't make any excuse not to to act.
Nice.
So you've been finding other ways. Making maybe a detour with some of your partners, but you found a way which they can understand, and then leave it up to you to translate it so they can actually implement it. That's great. Great example. Thank you.
Oh, that's a nice way. I'm getting so many nice citations here, like starting with the end in mind, building snowballs for change. I'm gonna use this a lot when I get back home. Thank you. So do we now have a question maybe? Nothing in the chat? Anybody in the room? Yes, Nigel, please. Can we get Nigel the microphone from behind there? Yeah.
Okay, thanks everyone for their comments. What's interesting is from Amit in India, we've got that aim to move perhaps from a focus of Olympic medals to an active nation. From Charlie in England, we've got this idea of trying to help on inactivity and inequalities. And Drew's talked about health promotion and prevention. One of the biggest issues I think we've got is how do we then measure and demonstrate the impact of what we're trying to do? What are the processes? It looks like Dean's going to come in here.
Yeah, I mean, I think measurement assessment is a very interesting thing in our worlds. And in the end of the day, I'm going to ask you to say, I'm going to take it out of the highly academic thinking of that, or in the education speak of assessment versus, charting and things, and say, what does success look like in your community if we achieve what we're all talking about here today? And I want you to paint that picture. What does your new community look like? Whether it's health literacy or physical literacy, you can't untangle them. So what does it look like? I would rather have that as the question than actually saying academically measuring things. And it scares me, to tell you the truth, because we can get caught up in the problem of saying, are enough people meeting a physical activity guideline? Whereas I'm going, well, that doesn't necessarily ensure health. That's one perspective of a measurement. I'm more interested nowadays, which we're going to do in the workshop, is in measuring, are we doing better in the process of communicating among people, which we haven't been doing, we're siloed. We can measure that. That is actually a process measurement as opposed to an outcome-focused thing. So I'm going to push for process assessment as opposed to outcome assessment. And I'm going to talk about what does success look like in your context if it were to happen. And that people can paint everybody.
So, Nigel, if I could also add, so in a number of our projects, we're funded by hospital foundations, which hospital foundations, for any of you that know, build stuff and buy stuff. They buy MRIs and they build wings of hospitals. But they're now investing in the community because they realize that one of the other processes they can do is not have people go to the hospital. What a concept. So actually, from a measurement standpoint, Nigel, you get a lot of people who are, we'll call them frequent flyers into Emerge, right? Because their circumstance is really on the edge. They're constantly. So how do we get those people serviced in the community in such a way that they can actually not be going to Emerge all the time? And so we've had people in with type 2 diabetes and COPD and various things like that who actually can get serviced in the community in such a way it's way more economical, okay, because dollars drive the bus a lot of the time, but it's very social because they're doing it with a group. So like cardiac rehab, which has been a fairly successful program for in medical side, very community oriented once they get punched out of the system. You get programs that allow people to come be together with others, okay, have somewhat of supervision involved, but they can exist. That we had this woman who walked in a walker, got on an elliptical, worked on this elliptical, and then got back on her walker and walked out. The only reason she's not in the hospital is because she does that. And we have to meet everybody where they're at. We need to be able to help people. I brought this up yesterday. Are we focusing in on the people who are 20 to 50 right now before they become older adults? No, we're not. So we need to be thinking about that in our whole system. And Dean is going to bring us forward with some ideas, I think, as we continue to talk.
Okay, thanks. One last remark.
Yeah,
from
just
Christian.
I heard a presentation by a lady who has invented ballroom fitness. So she's a dance teacher, and then she uses as an exercise, and she did that for years. And now she works with the Parkinson Association, and she got the same question: how do you measure success? And she said on the size of their smiles. And we were like all crying because she showed a movie of this person who walks very, can't walk with his Parkinson. She teaches the dancing, and he was a ballroom dancer, and suddenly he could remember everything. And the wife was in tears, and we all were in tears. So remember that, first of all, the size of the smile, and then we can discuss all the other stats afterwards.
Yeah, thank you. Okay, that was the closing remark for now. Thank you very much. Before you guys leave the stage, not Dean, we have some gifts for you guys because we're very appreciative that you would come all the way here and share your knowledge and experience with us. So let's give a big warm of applause for all the expert speakers. And we're moving on into the...
Yeah.
No, you can't. Into the workshop. Yeah.
Thank you.
Thank you, thank you, thank you. Nice. Now we have all been listening very intensely for a long time, and it's time to get back to work. Yeah, with the second section of the workshop, we're rolling up the sleeves. And for some people who were here in the morning, you're familiar with the starting point where we left it. For some people who are maybe new in the room, who were not here for the first part, you find some large sheets of papers on your table and think, what is this? And we're going to help you introduce where we are at and what's coming next. And Dean is here to guide us. We actually have that picture where we left things. So
Sure. So if you weren't here this morning, the tables came up with this. We didn't tell you this. You came up with this list. You said that when you're making decisions about health and well-being, which of course includes physical things as well, those are many of the topics that are really important to consider. There's not one topic more important than the other. And there's some other topics that may be there. The question mark says there's other literacies, we can't list them all, but those are the big ones. We also talked about who are the people that actually in your community or in your government, doesn't really matter, who are the people that help you make these decisions. And then we said, the target reminds us that each person, for each individual, each agent has a different effect on you. For you, it could be grandma. For you, it could be your next door neighbor. For me, it's my dog who tells me how to live properly. Okay? But everybody realizes that there are many agents involved in this complex system. That's the point. So that's where we ended this morning. And we understood the interaction, and we see that everybody had a different viewpoint, which is all valid, every viewpoint. So now what we're going to do is take a step into rolling up our sleeves, saying, how do we make action happen? And that's what the next bit is. So do you have the clicker? Yeah, we can go to next.
right there.
So in your table right now, if there's tables of 3 people, or if you only speak French, like right over there, or your primary language is French, it's sometimes interesting to actually take, if there's 2 people, if you feel like you don't need to move, but actually get differences of opinion. So if you like move into groups of people you don't know, it's very powerful for this next section. If you got enough people in one table, you're good, but getting some people that you don't know at your table is a really good idea. You don't have to, but feel free to move. So the very first question is a critical one as you move. And this is a question, I'm going to paraphrase it for you a few times. What is it that individuals need to be equipped to make health decisions? It's a very simple question, actually, but it's complex to answer. So if you said, I want my child to be equipped to make good health decisions, what do they need in their pockets, in their backpack, in their brain? What do they need in order to do so? So that's what your job is right now, is to, and importantly, and I'm going to do this again. You guys ready? Can everybody hold up your finger at your table? Just look like this. And what you're going to do, when I say 3, you're going to point to somebody who's going to take notes. You'll notice in front of you, there's some big pieces of paper. You guys ready? 1, 2, 3. Yeah. We know.
Nice.
So that person's a note taker. And I love this. So that person is the note taker. And your question, you're going to give you a few minutes now, and I'll prompt you a bit. And what I want you to do is say, what are the things people need to make good decisions? Anything is okay. Just write them down. Go for it. And pause just for a second. Sorry about that. So again, what you're doing here is basically saying, what are the basic things that people need to make decisions? Now, this is complicated, more complicated than thoughts, because of course we could say everybody should be given $1 million. You know, we solve poverty, we solve the problems of the world. But what you should be doing is coming up with a basic list of things. And really, this is a game, because the game is going to show you that what you're going to say here in conversations is actually what actually turns out to be literacy. And that's really, you're putting all the different things that are necessary to be a literate person, basically. And you might come up with some different ideas here. And what does the community need? And I'm going to use a very important concept for you. I got schooled on a really cool idea by these people called resiliency researchers. And they taught me that it's not enough to create resilient people. You need to have communities that are resilient, because if the resources aren't there, even if you're personally resilient, you're toast. So they say you need authentic resources that can be navigated to and negotiated for. That's their words. That's multi-systemic resilience theory in a nutshell. But it's critical that we in society need to provide all individuals with a list of things to equip them to make good decisions, because we can't be there all the time going like this. Makes sense. So I'm going to show you the next slide now, because I want this that we can move to action. Let's do it.
I'm a little bit curious if maybe we could get some samples of what people put there on this question before.
Let's do it. Let's do it. How about this table over here? List me 2 very important things people need to be equipped with. Go for it. I'll say it. Okay, you can have 3. Educated. Oh, parent as a role model. I heard you saying that. Building confidence and changing attitudes. And a nice environment. Cool. Very good. Okay. Yeah. Okay. Safe, useful spaces. Okay. Not just nice. Not just pretty. I get it. Those are pretty good. Yeah.
Nice.
Yeah. Do you have some additional ones? Otherwise, you can say ditto. But is there anything else you want to add to that? This table? Self-confidence. Yeah. Experiences as opposed to just being told. It's not just knowledge, but the experience of having it through that environment that is really cool. Very interesting here, both positive and negative. It's not about just having fun and enjoyment, it's how to overcome negative things, because you can't just live in this bubble wrapped world that we try to create for people. Let's go. Any other table? Want to shoot? Yeah. Motivation. So ability to use knowledge and execute on knowledge. And motivation is an interesting one because motivation is in almost every single literacy definition. But it's important to understand, and we could have a moment now, and we're not going to do it because we don't have time, where we say, what are all the different types of motivators? Some people get motivated for one reason, some people get motivated for another, some people for another, some people for another. So there's different forms of motivation, right? But your motivation today might be one thing, but tomorrow it could be a different reason. You could start a walk to talk to your friend, but then you see a beautiful bird, and now you're motivated because you want to be connected to nature. Do you follow me? Yeah. Ah, this is a very interesting concept. So the word was discipline. And that's a very difficult word to work with for a whole bunch of reasons. But it is bad for us to assume that everybody is motivated for one reason. We have what's called instrumental motivation, which is I'm doing it to make society better. I'm doing it to prevent disease. That's called instrumental. Then there's intrinsic reasons for doing it. I love to move, right? I love to eat properly. And then there's what's called relational motivations, which we say, I love to do it to be connected to people, places, objects, groups, other living things. So, but ultimately, how does discipline manifest? And that is a very complicated concept, but a very important one. What does disciplined mean? And that can get scary because if you're undisciplined, it's kind of shaming a person too. But good point. Right. So, right. Right. So this is critical in all of this, and I think most people in this room totally agree with this. What's your motivator? And it changes in a minute. My motivations change in a minute. And our friends at the WHO, not the health literacy friends, but definitely our non-communicable disease friends, have been telling us for a long time, if you're not a sweaty mess, you're going to create a disease burden on society. And that's called an instrumental valuation, which doesn't really motivate people to move. It doesn't work. It's a good knowledge, but it doesn't create action. It's not a behavior change, it's a threat. And then you said something even further, understand and accept all people have different motivations and those motivations change. I just paraphrased what you said. Okay, let's continue on here for a second. We can go on this. So what I did here was, and you'll get this from me, I have a definition of every single literacy that there is, and you're going to get that. So you can read all the dominant definitions of literacy, and that's fun. But if you look at all the definitions of literacy, sleep literacy, physical literacy, food literacy, there's like 60 of them, almost all of them use these words. Virtually all of them say that every literacy has skills. Like food literacy, you have to cut a fish. That's a physical literacy too. If you're filleting a fish, how do you boil and make spinach into gomae, or how do you make edamame? You know, and that's a physical skill. But there's also knowledge and understanding, but that's not enough. Because if you have knowledge, but you're not confident to do it, you won't do it. Or self-efficacy and confidence, we'll just make those the same. Almost all literacies say that, and then motivation. And the other one that I'm going to add to you is what's called valuation. I don't play pickleball. I know I've got white hair. I don't play paddle. That's a Swedish thing. I don't play pickleball, but I value pickleball for other people. You'll never see me play pickleball. I love pickleball, but I'll never play it. It's too loud. Yeah. Yeah. Anyway, what's important here is that valuation. And we published a paper a little while ago, and you'll really like this. Physical literacy people will love this. You ready? We asked kids the questions. We said, hey, how important is reading and writing at school? And they went, really important. How important is reading and writing at home? And they went, eh. Of course they can read and write, they can text. How important is reading and writing with your friends? Wah, wah. Then we asked the same kids, 12,000 kids, not a small study, and we said, how important is reading and writing, math at school? Really important. Then we said, how important is math with your friends? 0. Not that they can't do math, they have 0 value of math. But then we asked, how important is movement at school? Really important. Let me move. And Amit said something, sit for 5 hours at school? But I want to move at school. 12,000 Canadian kids said, I love to move at school. Then we said, how important is movement with family? Really important. And then the biggest one, how important is movement with friends? 9 out of 10. How important with math with friends? 0. How important was reading and writing with friends? 0. Doesn't mean they can't do it. But if you think about this now, movement valuation by children is through the roof in every social context. And yet we suppress movement for children. That means movement can be a vehicle of change for not just being more active, but better social skills, better mental skills, all of those things. So you guys created that list. Almost everything you said was related to literacy notions. Let's go to the next slide. Next slide.
Next slide. Yep.
Please.
Yep.
So here we go. This is going to be where we start our work. Very important question now. Who on earth is giving all this information to not just kids, but 65-year-olds? I'm 65. I'm on my 4th childhood. I started my 4th childhood just 5 years ago. If I get 2 more childhoods, I'm going to be really happy. Maybe 1 more, maybe tomorrow. But how are individuals and communities equipped with all of the things that we're talking about? Who's giving it to them? And who should be giving it to them? And how do they get all of this information and knowledge and skills and confidence and motivation? How do you equip them? What is necessary? Who and what is necessary to give it to them? And you can start talking about sectors. You can talking about who, blah, 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 role models, parents, etc. So have a discussion and try to answer, how are you giving skills and knowledge coupled to confidence, motivations and valuations to people in society? And don't just think kids. That's ageist. Think 0 to 112. If you're 113, it doesn't count. Okay, so 0 to 100, or even -9. -9 months to 112. How are you equipping people in society? Go for it. Just pause just for a second. So what everybody should be realizing here, and again, I accept the fact that you want to keep talking and I'm interrupting you, and I apologize all the time. I'm a jerk. But yeah, thank you. What's relevant here is that you should be realizing that these discussions that we're fostering, we should be doing and having these discussions a lot more. Hours on hours with all of our sectors across the table. This is critical conversations because if you're going to realize, I'll give you the example. Literacy went from 21% in the world in 1900 to 87%. That's pretty impressive success. The primary sector that did that was a mandate provided to the public education system, which is the foundation of the Convention of the Rights of the Child. They said people need to have literacy skills, basic literacy, read, write type things for everybody, because the world will be a better place. Math, the same. That's why both math and literacy rose to the surface, but it took them 125 years to put it into the education, public education systems worldwide. Just 125 years. But better late than never. But now we in health literacy are saying, and I'll give you an example. Sarah's here from, formerly president of SHAPE America, Society for Health and Physical Education. You can't just place health literacy and physical literacy on the backs of physical education and health education. We need way better health education and physical education worldwide. There's zero doubt. And if you've been talking about that, good on you. But what are all the other sectors and how do they work together, which they don't do, to actually equip people? How are parents getting better at feeling good about equipping their children? Because the children's primary question about health will be either to their friends or to their family, not to sectors. If they have a trusted teacher, perhaps. But the coach in sport has a role in this. Everybody has a role in it. So if you show the next slide,
Yeah.
you should have been talking about, hey, there's a bunch of people on the right-hand side, agents working for us, but there's a bunch of sectors. And there is just a list. You should have come up with some of that list and saying, these are the different sectors that need to work together, not separately, because we compete with each other, right? We compete. The sleep people talk about sleep. The food people talk about food. But in reality, they're all intermixed. And nobody yet in the world has actually brought it all together. And that's the problem. But the fact is, you have to make health decisions every day based on all of these topics. It's unavoidable. And so we're in a time right now where this conference is a beautiful example of having way more sectors than sport for the first time. Not everybody's here that we need to have here. Not all of those sectors are here. Is anybody a priest? Oh, the religious sector, are you here? Interesting, maybe. So, but they're an important sector, would you not agree? They can strongly influence health decisions, both good and bad direction, of course. But where is the institution of religion? Why are they not here? Should they be here? Interesting. Yeah, okay, good. I would agree.
Yeah.
So in the end of the day, where are the architects? There were some here earlier in the room, but we need more architects, more city planners, more mayors, more prime ministers. You know, all of those sort of people should be in this room, not just texting away, but actually interacting. They need to hear you, right? Where's the principals of schools, the superintendents? So I just wanted you to see and read the top part. Skills and knowledge are gained through formal learning experiences and experiences. You can't just tell people something. They have to have the experience to know that they can do it themselves. Otherwise, they look to other people to make decisions. So that's pretty simple. Let's move to the next slide, Grim. So here we go. Let's just say you made a beautiful community, beautiful meaning nice, well-equipped. I want to know, if you live in this beautiful place, what resources are necessary? And I'm going to seed you a little bit here. What programs are necessary for all people, independent of ability or background? And what training is necessary of people? And what places need to be made? So people, places, and programs, which was what Drew was talking about, not just for sport. What are the people, places, and programs that are needed in our beautiful, successful community? Talk about it. Go for it. And I really hate the fact that I do actually. No, I don't. It is critical, and I'm actually violating one of the physical literacy rules of positive experiences by doing what I'm doing. Everybody here needs to have their voice heard across the table, but I'm interrupting you before that can happen. I apologize, because that actually creates negative things in you. I do not like creating social inhibition, and that is a very bad thing to break, but I have limited time to provide this workshop, because I think already by now you'll have experienced the notion that there's one heck of a lot of resources that we need to create. Now, what I'm going to focus you on here is that we heard a lot, maybe 3 or 4 people today talk about Parkinson's, okay? And so, like, what are the, and I'll give you, I want you to feel this in relation to your conversation. You ready? Hey, I've got a recreation center that has great activity for people, and it's 2 blocks away from this community. 2 blocks away, not very far. but the 2 blocks away is unsafe to walk through. And the community center said, but our programs are here. Well, somebody needs to take responsibility for safe passage in that area. So that makes that resource, we've got the resource. No, you don't, because they can't access it. So accessibility and programs for all abilities is critical. So if you go to Wyndham in Australia, which is one of the largest growing communities in Australia, it went from 5% of that city from India. Now 75% of that population is from India. If you don't have culturally sensitive and appropriate programs and places that accept cricket as the national life, you really aren't meeting the needs of your community. So to me, it's all about, do you have programs and places that aren't just made for the average person, or as Kristen says, not every gray-haired person wants to go to physiotherapy classes. Some of us like to do what kids like to do and so get into kayaks and things like that. Yeah. So I want you to be challenged about, but you're also now feeling we don't have infinite resources. How do you do that? But that's the challenge, is that I now, because I travel the world on this, I'm telling you, I've seen over 300 diamonds being created in this space. Examples that who said it? Drew said, the solutions are already in communities. So that community has a solution, but nobody's talking about it and sharing it. That would be a great thing. How did you do that? Oh, you did it? Okay, tell us how. Sharing the stories of success become inspiration, and we don't have a platform to do that. And it's all about the storytelling as opposed to the data. Oh, how did you do that? And there's hundreds of examples. We don't have time. Let's move on to the next one quickly. That's me. Whoop. So here is a summary of some of the things you're saying. Critical considerations for community transformation for health and well-being requires places that are authentic, safe, and accessible for people of all backgrounds to enact their health and well-being decisions. Programs. Are there programs suited to all individuals independent of ability, with autism, neurally diverse people, blah, blah, blah? Are there programs staffed by well-trained individuals, not just by well-intentioned individuals? Well-intentioned does not mean well-trained. Can these programs be readily navigated to and negotiated for? Some of you come from countries that have public health care, but there are countries that have non-public health care. What does that mean? You can't take a public health care mindset and apply it to a country that doesn't have public health care. That's a completely different scenario. Last one, people. Is there quality training to create new places and programs? Is there? Like, are we creating good phys ed teachers, or creating phys ed teachers that are 20 years and thinking old? And most of us should be going, yes, it's 20 years old. But does quality training exist for the staff programs, professional development training? Those are the questions that you are probably discussing to a degree. So it is about creating places, programs, and people. And I'm going through this quickly. I showed you that model already. You, through the 2 sessions so far, without me showing you that model, you came up with it. You actually told me there are people that can equip individuals in community. Individuals in community need to seek information when they don't know what to do. These people on the left, the agents have to also resource people, places, and programs. And only when all of that happens can you then say, take responsibility. But if you blame people for not acting on good health right now without all of that in place, you're shaming people, and that's inappropriate. They can't be accountable. So what I'm showing you here, and Kristen, this works beautifully with Kristen's model because it basically says, who are the people that are necessary in health leadership? Who are the people that are needed to equip people, etc.? So we also said those are all of the different literacies that are important for people. That's called the ORB model of health literacy. And you'll notice that each one of those orbs is part of health literacy because they're all about well-being. And you told me that as well. You said, these are all the health decisions that people make. And therefore, there's knowledge, skills, self-efficacy, evaluation, motivation for every single one of those. And I'm going to give you a big one. Have you ever heard of vaping? Yeah, vaping. E-cigarettes. If you're from so I could say, and we could do this, and it's a good exercise, take vaping, and you put it, what are all the different literacies that are involved with vaping? It's not just one, it's not just a healthcare issue. It's many of those. Cultural, linguistic. I don't need to talk to my Swedish friends about snooze. Yeah? One culture. Like I come from the rodeo culture in Canada, and we don't use snooze, we put tobacco in our mouths, etc. But culturally specific training. So I show you that you can take a thing like vaping and say, what are all the skills from each one of those that are necessary to know? What is all the knowledge? What is all the motivation specific to vaping? That makes the answer come clear, as opposed to don't vape because you might get oral cancer. That's a medical thought. Make sense? Let's keep going. So you guys did this. You said, here are all the topics that you need to think about, skills, knowledge, etc. And those agents help equip people in your community with the skills, knowledge, motivation, valuation, self-efficacy. And if you also equip them with the people, places, and programs, they can finally act well. And it goes from awareness to decisions to actions. We talked about decisions this morning, right? We're trying to just make the process of awareness, the decisions to action happen big. So this actually, take a look at that diagram. We're almost done. You may have seen that earlier. This person made this beautiful diagram. And now you can say, if you think about it, what is the health literacy workforce? It's all of us. But we all don't know we're part of it. Who are the health literacy organizations? Every single one of those orbs is a health literacy organization. Are they here today? The sleep literacy people aren't here. The death and dying literacy people aren't here. But they have a full field. They don't even know they're part of health literacy. But if you talk to them, they probably go, oh yeah, we are. Yeah, we are. So this informs the beautiful statements about people-centered services and environments. We just talked about that. Individually specific programs. That last slide informs this slide. This is the 10,000-foot view. And the slide I just showed you, which you told me about in the 2 sessions, is how do you enact this? Make sense so far? But you told me this. That's you, not me. And then finally, and this is what we're going to finish up on today, there's some stickies. Yeah, Post-its. I want everybody to grab a pen right now. Grab a pen. And each of you get 3 or 4 stickies. And what I want you to do, and I really want you to do it, is I want you to write down using your pen what you can do tomorrow. It could be color pen. Oh, green is great. But yeah, but it could be purple. Purple, any color. And I need you to do this. You're going to write down what you can do tomorrow for you. Then you're going to write down on another sticky sheet what you're going to do for your friends or family. I have no friends or family, so I won't have to answer that. But what you can do for your community is another sticky. And then the last one is your sector. What I'm doing is making it personal first. I don't want you to think about your sector that you work in. I want you to think about you and your community and write down what you're going to do tomorrow from what we just talked about. And then write down about your sector and write it each on a different sticky. Very important to do that. Go for it. 5 things you're going to do. 3 things.
Yeah, don't ask how we're doing with time. You don't want to know.
No. One last little thing. I know you're still writing, and I like this because you're probably realizing now there's many things you can do tomorrow. I want you to continue writing as you do this, and then on a sheet of paper, everybody's got some sheets of paper like this. Do you see this on your table? I want you to actually part with your things and just stick them. We're going to scan them with the Post-it app, if I can read your writing. And then what will happen is we're going to see a whole bunch of Post-its saying we're going to do something tomorrow. Make sense? So stick them on the table and leave your action statements on the table. And that's the end of this workshop. But Grim's got lots more tying up to do.
Yes.
So I'll pass it back to Grim, and I want to thank you so much for participating in this. Thank you.
Thank you very much for guiding us through that process, Dean. I can tell that the energy in the room has been going up and down a little bit, but we're all feeling now that it's time for a lunch break. Before I let you off, though, we have a short time for making the evaluation survey. So when you've written your notes, please bring up your phone and put in the evaluation of the session how your experience has been. Please do that now. We'll take a couple of minutes. Okay, nice. I think some of you finished now to complete that evaluation survey. And if I were to say something that I am taking with me that I want to do tomorrow for my sector and many other sectors that we're collaborating with, I'm thinking that I'm taking this workshop plan with me to do it in our local community up in Umeå, because I think that can be a great tool for helping us see how different health-related agents can find a neutral and shared platform for advancing this work. And I also I found this quote actually by a Russian chemist, Dmitry Mendeleev. Anybody familiar know about him? Dean? Yeah, some of us. Dmitry Mendeleev. What did he invent? Yes, the periodic table. All the way back in 1869. Dmitry Mendeleev invented the periodic table, and he intentionally left room for other elements yet to be discovered. It wasn't finished. And I think that's a nice way to think about the work that we're doing now, that the models are not perfect, but we're on an explorative journey together, thinking about how it all fits together and not. And yeah, I would like to leave you with that. Some recommendations for moving forward. Do this workshop at home. We're going to make sure that you get the slides and the questions. You can do it with your partners that you need to collaborate with to get that shared platform and direction for your health and movement related work. Also, make sure to check out the Moving for Health training tool, the starting point for all of this. There are some great resources there that's been gathered from all around Europe that I think you will really appreciate. And all the experts who were contributing through the fireside chat with their presentation, they put resources together in a document that you can access via this session in the app. So you can go there and find information about upcoming events and links to web pages where you can find the listening circle that Charlie told us about, for example, invited us to participate in, for example. Well, that's the survey again. We already did that. And yeah, I guess that was the last slide for now. So now it's time for, no, Carol, Drew. Oh, you got the mic. Yes, look that way, everybody. Drew is back. Yeah.
Just quickly, you may see one of these on your table. This is the International Physical Literacy Conference. It's going to be held in Toulouse, France, next October 1 to 3. Just want to please take one. Be curious. Love to see you and have further discussions around physical literacy. Thank you for a great job, Grim.
Okay, thank you. Yeah, so big rounds of applause and